Junior doctors in England have started a 6-day strike after talks between the government and the British Medical Association broke down last month.
It's over. The dispute is over pay and conditions. The BMA senior doctors say their pay has been cut by more than a quarter since 2008.
The Health Secretary, Victoria Atkins, has issued a statement that says, "I urge the BMA Junior Doctors Committee to call off their strikes and come back to the negotiating table so we can find a fair and reasonable solution to end the strikes once and for all."
Well, let's talk to now Junior Doctor, Dr. Basha Mukherjee. Good morning to you.
Good morning.
You will have noticed yesterday, Doctor, that we had the highest ever post-war number of excess deaths in this country, 53,000. Do you accept some responsibility for that because of your continued strikes?
I will have to say that this is not just the responsibility of the doctor.
No, I'm asking if you do accept some responsibility.
I guess there's a consequence to every action. So for those people who have been striking, then there is a level of responsibility that we have to carry with us, yes.
I find it utterly extraordinary that at this time of year, in January, when we know that particularly the elderly are more at risk at this time of year, and there are people with immune systems that frankly are not working very well after the last 3 years, that this is the time in which doctors are choosing to take this strike action. Is this not better to at least get through the winter, maybe into the spring? And if you still feel the need to take the action in the summer, then do so then.
We were having this exact same conversation last summer as well, and this has been started since the beginning of spring last year. So it just seems that the government are not willing to listen to us, and there's no real right time. This exact conversation of the exact number of deaths and all the effect on the NHS, this was being had last year. I mean, the delayed action of the government, I'm absolutely appalled at.
Oh, that's a shame.
We've lost Dr. Basha Mukherjee. We'll try and get her back. But just to remind you, they've started the junior doctor strike today. It's 6 days of strikes. It is the longest strike in the history of the NHS.
The thing is, as well, the junior doctor's title is a little bit misleading,
Very
actually,
misleading.
because it's just
We've
basically...
We've got her back.
Good morning.
We've got you back.
Dr. Basha Mukherjee, I think you're back with us. Hello. Sorry about that. Would you just clarify as well, because junior doctors isn't really the right definition for who you guys are, is it? It's not as though you've just left university.
For people, anybody who's not a consultant, essentially. So they could be first year in the training program, or they could be many, many years into the training program. So there really is a very different level of experience in this whole terminology. And that's why I think this is a really important discussion, because it affects so many doctors, and so many doctors are part of this movement because we truly believe in it.
35% pay rise under the conditions at the moment of the fact that we have this terrible debt burden in the UK just sounds unreasonable.
Well, as the discussion's been had, it's not that we're asking for it all one go. We are happy to discuss, and we're happy to negotiate. I think that's where the conversation has been about. Negotiate with us, bring us some alternatives, or even something that's palatable, that keeps all these doctors to stay in the NHS. I think what we're trying to avoid is the alternative, which is a mass exodus already happening of doctors leaving the country, working abroad, working in the private sector. They're still going to be doing patient care there, but it's just not going to be in the NHS, and we're going to be left over with leftover doctors, which we really don't want.
But isn't Beverly right? 35% is unreasonable, Doctor. You've been offered 10.3%. Inflation is currently running at 4.2%. We accept your pay has been squeezed over the last decade, but that's the same across the board in the public sector, and dare I say, in many parts of the private sector too.
But the conversation is about how much does that actually mean in real terms. It would have amounted to the exact amount which the government has already spent trying to essentially work against us by paying locum doctors to cover the shifts, which, well, as you're saying, it's still resulting in these number of deaths and all the delays and the appointments and all the rest of it. So what are we really achieving here? The government needs to work with us, not against us. And right now, the doctors feel like we don't have anybody on our side.
Well, what are you achieving?
They are on our side.
Well, what are you achieving? This has been going on since the summer, and it's just led to a dramatic increase in waiting lists, the biggest increase in excess deaths in post-war history. What have you achieved, Doctor?
Well, I worry that by not being heard by essentially our employer, what this means is the employees, the doctors, they don't feel valued, and this is why they're all leaving. And that's part of my future plan as well. If we don't get a better
don't feel valued. It's an interesting thing when you say you don't feel valued, because I think what happened during the pandemic was this paradigm shift that we were told we had to save the NHS. It was a complete reversal of what the NHS is there to do, which is actually to save us. Is it fair to say that junior doctors now are just basically a little bit sulky about the fact that we're no longer clapping you on a Thursday night and hitting pans with spoons in order to applaud you? We have to go back to remembering that doctors are there, and the vast majority do an unbelievably good job. The doctors are there to look after the patient. It is not the patient's job to sit on a waiting list for 2 years so that you can get paid more money.
As much as I completely hear what you're saying, we have to remember that as doctors, we could do that exact same job in any other part of the world. And that's exactly what's happening. Doctors are leaving the country, working in different parts of the world where they do feel more valued. And essentially, they could be doing more good in the society if it was a perspective of doing charity.
OK, all right, we appreciate you joining us this morning. Junior doctor there, Dr Basha Mukherjee. Health and Social Affairs Editor of the Sunday Express, Lucy Johnson, is in the studio. Good morning, Lucy.
Hello, good morning.
Did we not seem terribly sympathetic there, Andrew and I, to that lady?
Well, I question whether doctors really are leaving in huge waves, if there is really an exodus. The last time I looked at it, there was only a small proportion, I think 3%, and the ones that leave often come back. So that's a normal thing. They often threaten to leave, but I'm not...
Because they tell us this all the time, that people are going to Australia, sunnier climes, where they get more money. They don't work in an NHS, of course, in Australia in sunnier climes.
Yes,
yeah, of course.
Yeah. And I understand the temptation to do that, but the figures... The last time I looked didn't stack up, didn't support that. So I'm not convinced. The junior doctors have an average of about £50,000 a year. That's what they earn on average. So when they do talk about their pay being the same as a pret-a-manger...
It's not true, is it?
Well, with out-of-hours pay and with bonuses, it adds up to about that. And, of course, they have huge career progression and salary advancement opportunities, which is very clear. So they will, as consultants, be earning a six-figure salary.
Will some of these NHS doctors also be doing private work on the side?
Well, that is very true. And many of them go on to do private work at weekends or on their days off. So
or on their strike days, presumably.
Well, that has happened, but I think that they can end up doing locum work. So I think that it is true that junior doctors do have huge debts, and that would be one thing that the government could look at. I mean, they can rack up about £100,000 worth of debt during their training, and if we do want to keep doctors here, and there is a threat of doctors leaving, we could do something like for every year they work, we pay back, the government pays back, or the NHS actually pays back a part of that debt, because it's quite difficult to service that debt with the interest rate so high.
Yeah.
And I think, as you've said, 35% pay restoration. The Institute of Fiscal Studies has looked at their declining pay in real terms, and it doesn't match what they are claiming. So there is a debate, there's a dispute over that. The Institute of Fiscal Studies, I think, said it's 11 to 16% since 2010, and they say it's 35% since 2008-9. So, those figures, data can sort of show different things.
And we can argue about the numbers, can't we, Lucy, of course, but the real number that was driven home to me this week was that number yesterday we saw about the extra 53,000 excess deaths, the largest increase since the Second World War. That has to be, I'm not saying whether they should be on strike, but the strike has to be a major factor.
Well, it's really hard to tell whether the excess deaths are due to NHS, the problems, the tipping point now that the NHS is facing. It's difficult to know, but the fact is we have 7.1 million people on the waiting list.
Incredible.
We have over a million procedures cancelled. There will be people with fast progressing cancers that will not be diagnosed. People are really struggling. It's a dreadful situation. And the fact that, I was talking to Victoria Atkins, the Health Secretary's office the other day, and they said, we will not come back to the table until they stop striking. And that's
we need
wrong.
to move on, Lucy. I'm so sorry. Let us know your thoughts this morning. GB Views at gbnews.uk.